recorded classes also, so which you can access the subjects at any time and anywhere. And we also offer you notes, which give which are actually ultimate comprehensive books with CBME-based question answers, MCQs, and you also have a fun zone for self-assessment. And there are MCQs from beginner level to the expert level. Recorded classes also, so which you can access the subjects at any time and anywhere. And we also offer you notes. I think my voice is which are actually ultimate comprehensive books with CBME-based question answers, MCQs, and we also have a fun zone for self-assessment. Hello. There are MCQs from beginner level to the expert level. Recorded classes also. I think my voice was like, okay, thank you. So so here we have the MCQs from regular level to the expert level. So they are standard multiple choice questions based on the CBME pattern. So here you can you can do your self-assessment and boost your confidence. And you can use the code given below, that is Dr. DIVY 20 for first free live class. And we have some subscription plans for you. So basic plan for 3 months, standard 6 months. And there is a mentorship plan, which is a wholesome plan for 12 months, which we offer at a special rate of 50K. So here we give you pre-recorded classes, live classes. Then there is also live doubt clarification. And the best part of it is one-to-one personalized guidance. And notes are also given, as well as there is a quick revision of examination module. So you can use the code DRDIVYA20 for discount on the subscription. And so there's no waiting long. So you can book a slot for personalized counseling session and get the benefit of it. So this internal marathon is basically for the exam preparation. So we have started it from April 22nd. And here we give you a rapid revision of all the important questions which are repeatedly asked in the different state questions, university questions, as well as there is volatile facts. We also deal on these facts, which for a quick revision, and there is multiple choice questions also will be covered. And here, with all these things, we assure you of top-notch grades in your exam. So this internal exam marathon sessions are beneficial for everyone. So any university exams. So today's session, we will begin now. So today's objectives are, we will deal with how to write about parotid gland and related structures there. Then muscles of mastication, the temporomandibular joint, mandibular nerve, and short answers, maxillary artery and otic ganglion. So these are some of the questions which are very commonly asked. So you can see it every other paper. So we will start with it. So first question is parotid gland. Okay, so when this question is asked, usually this question is asked as a long essay question, and part of it is asked as short essay too, or short answers also it is asked. So usually when a gland is asked as a long essay question, these are the headings under which you should write it. Explain it, like, the location, the coverings, the presenting parts, relations, the structures, especially in parotid gland. We also talk about the structures within the gland, the parotid duct, the nerve supply is important, and applied aspects of it. So parotid gland, when we say parotid, so otid means ear and paro means around the ear. Okay, so that is why it is called as parotid gland. So it is located in this parotid region. This region, we call it as the parotid region. So it is the largest of the three salivary, major salivary glands. And if you see the shape of it, it is inverted, pyramidal shaped. The apex is directed downwards. So this parotid gland has two coverings, that is otherwise called as the capsules. One is the true capsule, which is formed by the condensation of the stroma of the gland itself. And other one is the false capsule, which is formed by the investing layer of the deep cervical fascia. So here you can see this deep cervical fascia, which is the deep fascia of the neck. It splits to enclose the gland. So it splits into a superficial lamina and a deep lamina. The superficial lamina covers the gland and it gets attached to the zygomatic arch, and anteriorly it fuses with that is, it condenses with the mesenteric fascia to form the parotidomesenteric fascia. The deep lamina, it is attached to the styloid process here and to the tympanic plate. And in between, it is thickened to form the stylomandibular ligament also. So coming to the presenting parts of the gland. So presenting parts, when we say, it is the surfaces, borders, like that. Okay, so here what are we talking about? The parotid gland. So it has 4 surfaces and 3 borders. So this is a schematic representation of the gland. So when I say it is an inverted pyramidal shaped gland, so it looks like this. Okay, so it has an anterior border here. Okay, this is the posterior border. And here in the center will be the medial border towards the medial side. And it has 4 surfaces. So the surfaces are, this is the superficial surface, which is otherwise you can also say lateral surface. And here will be the anteromedial surface this side and posteromedial surface on this side. And this one, the base of the pyramid, we also call it as the superior surface or the base. And this will be the apex. So these are the presenting parts of the gland. So we will, so when we take a section, so this is like the outward appearance, like when we see it in this way. So when we take a section of this and see, this is how it will look. So this is a transverse section. So if you see here, so this is the ramus of the mandible, and these are the muscles around the ramus of the mandible. And this is the mastoid process and the muscles around the mastoid process here. Okay, so in between here, we have this parotid gland. So this will be the skin, and here we have the superficial fascia and the deep fascia here. And this is the parotid gland. These are the superficial lymph nodes, parotid lymph nodes. So this surface, what we are seeing here, this surface is called as the superficial surface or the lateral surface. So this border here will be the anterior border, and this border here will be the posterior border. And this border, which is pointing towards the pharyngeal wall, which is called as the medial border. So this surface between this anterior border and the medial border anteriorly will the anteromedial surface, and this is the posteromedial surface. So this is what, and so we have to learn about the relations of these parts. So we'll go one by one. So first is the apex. So apex is directed downwards, okay, towards the neck. So here near the apex, 2 divisions. So you can see here 2 divisions of the retromandibular nerve, they emerge here. And one nerve, that is the cervical branch of facial nerve, emerges from the apex. So this is important. So you should know that is the apex. It overlaps here, the posterior belly of the digastric. And in relation to the apex, we will see these 2 divisions of retromandibular vein and the cervical branch of facial nerve. Then the base is towards the external acoustic meatus. Okay, so it will be enclosing, that is encircling this, not enclosing, encircling the external auditory meatus. Okay, so this is the base. So here in relation to the, and here, okay, so this is the superficial surface here. So this is a superficial surface is related to the skin. Okay, then we have the superficial fascia, and then we have the deep fascia, and we have these, what is that? Parotid lymph nodes, that is the superficial lymph nodes. And deep to that will be this parotid gland. Okay, so with the skin, we see small portion of platysma muscle also in the lower part. Okay, so these are the things, relations with the superficial surface or the lateral surface, as I told you earlier. Then coming to the anteromedial surface. Now this is the anteromedial surface. Okay, so this is the pharyngeal wall. So this is the anterior border. This is the posterior border. So this is the masseter. The ramus of the mandible, and this is the masseter muscle here on the outside, and towards the inside we have the medial pterygoid muscle attached. Okay, so this ramus of the mandible, along with these 2 muscles attached, form the anteromedial relation. As well as we will also see this structure, that is the parotid duct, emerging along the anterior border as well as the branches of facial nerve. Okay, so this, when I talk about the borders, I will tell you. So this is the thing. So each surface and what are the structures in relation to that, you have to know. This is very commonly asked. So usually for a structural relation, you can draw this transverse section diagram, this or this simple, where was this? This was simple diagram. Okay, and you can explain. Okay, so it's the same one and the same. So that is about the anteromedial surface, what we see. And then we have along the anterior border, what I said. So this anterior border here, what we have. So when we see it in this side, that is the lateral view, we will see like this. So this is the anterior border. So along the anterior border, the branches of the facial nerve will emerge along with the parotid duct. So when we go from above downwards, we have the zygomatic branch. Okay. Then we have the transverse facial artery. We have the upper buccal branch, then the parotid duct with the accessory parotid gland. Then below that will be the lower buccal nerve and the marginal mandibular nerve. Okay, so the zygomatic nerve, upper buccal, lower buccal, and marginal mandibular nerve are the three branches. Okay, buccal is divided into upper buccal and lower buccal. So these three branches, they emerge along the anterior border. Okay, so other day we learned about the facial nerve and its branches, right? So these are the three branches which are coming from here. So this is the relations in relation to the anterior border. So coming to the posterior border, okay? So this is the posterior border here. So posterior border is related to the sternocleidomastoid muscle here. Okay, so we have this sternocleidomastoid, and along the posterior border, we will also see this. That is the posterior auricular artery and the posterior auricular nerve, okay, which will be in relation to the posterior border. And along this medial border, okay, so medial border, it is related to the pharynx, okay. So here we have the superior constrictor muscle of the pharynx, and it will be related to the pharynx. Then we have here posteromedial surface here. So this is the posteromedial surface. So posteromedial surface, if you see here, it is related to the mastoid process. So on the outside of the mastoid process, we have the attachment of the sternocleidomastoid muscle, and in the digastric fossa there, okay, we have that is, the digastric notch there, we have the posterior belly of the digastric, okay. And this is the styloid process with these three muscles attachment. Okay, this is known as the styloid apparatus, where the styloid process with its three muscles and two ligaments attached, we call it as the styloid apparatus. Okay, so we have the styloglossus, stylopharyngeus medially, and stylohyoid posteriorly attached to the styloid process. So between the styloid process and the mastoid process, we have the stylomastoid foramen from which emerges the facial nerve. So the facial nerve is coming there and it pierces this posteromedial surface, okay, and passes through the substance of the gland. That is why in a transverse section, we see the nerve like this because it is passing horizontally across the gland. Whereas the artery and the vein, we see it like a cross section here, okay. And also onto the inner surface, we also see the internal carotid artery, the internal jugular vein, as well as the last, that is the 9th, 10th, 11th, 12th. The last four cranial nerves are seen in relation to the posteromedial surface. Okay, then along the borders, already I told you what is there along the anterior border and the posterior border towards the apex. So near the base or the superior surface, we have auriculotemporal nerve and the superficial temporal artery and temporal vein. So these are the structures in relation to the parotid gland on the externally. Okay, internally, what are the structures passing through? So this can be asked even as a 3-mark question. Okay, so first, there are three structures. That is the artery, one vein, and one nerve. Okay, so artery, vein, nerve, they pass through the gland. So when we go to the most deepest part, okay, the deepest portion will be the structure will be the artery. So the artery is running upwards. So which artery is this? It is the external carotid artery. So external carotid artery runs through the substance of the parotid gland and it will divide into its terminal branches there. That is the maxillary artery, okay, and the superficial temporal artery. Okay, so maxillary and superficial temporal artery is formed within the substance of the parotid gland. Okay, and that will be the deepest structure, means the most medial structure. Then will be the intermediate, will be the vein. So vein, which vein is this? It is the retromandibular vein. So how is it formed? So there is formation of this retromandibular vein within the substance of the parotid gland. So which are the veins contributing to its formation? One is the superficial temporal vein and the maxillary vein. So these two veins join to form the retromandibular vein. And this retromandibular vein near the apex will divide into an anterior division and a posterior division and emerge out near the apex. Okay, so this is the intermediate structure. And the most superficial will be the nerve. So you can see the nerve. The facial nerve, it will pierce through the posterior medial nerve to the surface. Their posterior border, it pierces, enters the substance of the parotid gland, and within the parotid gland, it will divide. Okay, so it actually divides into two branches mainly, that is temporofacial and cervicofacial. Temporofacial will form temporal branch and the zygomatic branch, whereas the cervicofacial will give the upper buccal, lower buccal, marginal mandibular, and the cervical. Okay, so if you see these nerves which are emerging, the 5 nerves, okay, it looks like the feet of the duck. Okay, like a feet of the duck. So that is why it is called as the pes anserinus. Pes anserinus means, pes means the foot, anserinus is for the duck. Okay, so radius like the goose foot or the duck's foot. So it looks that way. Then a word about the parotid duct. Okay, so duct of the parotid gland, we call it as the parotid duct or Stenson's duct. Okay, so it is a very thick walled duct, and it is about 5 centimeter long, and the diameter is about 5 millimeters. So what does it do? So basically, from all the lobules of the gland, it will carry its secretions, that is the saliva. So where it leads, it brings that saliva to the oral cavity. Okay, so how does it pass through? So when this, after the parotid gland, a duct emerges. Okay, so it passes along the lateral surface of this masseter muscle. Okay, so it runs along that. Then it turns at right angles. Okay, so first right angle, it turns here. So it pierces through this buccal pad of fat. Okay, the buccopharyngeal membrane, the buccinator muscle. And once after it pierces the buccinator muscle, okay, it will again make another 90 degree, okay, passes and runs across for a little distance and again turns one more 90 degree and it opens at the parotid papillae. So this is at the opposite to the vestibule of the second, crown of the second molar, okay. So it is seen there. So you can see the opening here, small opening here. So it opens in the vestibule of the mouth, oral cavity, okay, opposite the crown of second molar, upper molar. You should know that. So, and you should also know what are the structures pierced by it and how many right angle curves it makes, okay. And the nerve supply, coming to the nerve supply. So the gland, it has got both parasympathetic and sympathetic nerve supply. So the preganglionic fibers of the parasympathetic, it begins, okay, from the inferior salivatory ganglion. So from here begins actually the glossopharyngeal nerve. So the glossopharyngeal nerve gives a tympanic branch, and this tympanic branch forms the tympanic plexus within the middle ear cavity, okay, on the promontory it forms. And from this tympanic plexus begins the lesser petrosal nerve. Lesser petrosal nerve will relay in the otic ganglion. So till here, it is the preganglionic fibers. So from this otic ganglion, the postganglionic fibers begin, and through the auriculotemporal nerve supplies the parotid gland. Okay. The sympathetic supply here, if you see, it is through the plexus around the external carotid artery. So where do these plexus come from? Okay, so they come from the T1 and T2 that is sympathetic nerves, okay, and they pass through the superior cervical ganglion. So here, these will be the preganglionic. Postganglionic fibers begin from the what is that? Superior cervical ganglion, and they form a plexus around the external carotid artery and then supply the gland. Okay, so this is a simple diagram which you can draw and show. So you need to draw. See, anatomy without diagrams is no anatomy. Okay, so for to have a better impression and to score better, wherever you can draw diagram, you need to draw diagram and represent what you are trying to say there through the diagram. So this is the inferior salivatory nucleus, which is situated in the medulla. So you can see the glossopharyngeal nerve begins there, okay, passes through the jugular foramen and comes out. So it gives the tympanic branch. Tympanic branch forms the tympanic plexus within the middle ear cavity. From there begins the lesser petrosal. Okay, lesser petrosal passes through the foramen ovale, and this relays where in the otic ganglion. The postganglionic fibers begin, and through the auriculotemporal nerve, it supplies the parotid gland. That is the parasympathetic. And this one, what is the sympathetic? It begins from the T1 spinal segment, the preganglionic, relays in the superior cervical ganglion. Postganglion begins, they form a plexus around the carotid, that is the external carotid. And then with they do not relay here, they just pass through the ganglion, and through the fibers of this auriculotemporal nerve only, it will be supplying the gland. Okay. So this is the nerve supply. So lymphatic drainage, it is drained into the parotid, superficial and deep parotid group of lymph nodes. So deep will be those upper deep cervical group of lymph nodes. Okay, so you have the superficial here and the post-auricular, occipital. So in this region, it drains. Okay. So clinical anatomy, when you write about, okay, so usually applied aspects will carry more weightage in the answers. Okay, so you should know. So one is mumps. Mumps is a viral disease which is caused by the mumps virus. So there is swelling. Okay, it is very painful because the parotid fascia, which is enclosing the gland, since it is a dense connective tissue, it cannot expand. Okay, as the gland enlarges because of the infections. But in viral, we do not see any formation of abscess or pus there. Okay, it doesn't suppurate. And usually it is associated with inflammation of the testis, which is called as orchitis, and also we see for pancreatitis. So we have to check for the inflammation here in the testis, as well as we look for pancreatic enzymes and see if it is any elevated. Okay. Whereas if it is a bacterial infection, okay, it can be acute or chronic, or it can be recurrently happening. Okay. So this is basically because of poor oral hygiene. Okay. So through the duct, the infection can spread. The bacteria can go reach the gland. Okay. So this, usually when it is a bacterial infection, what happens is there is collection or there is formation of the pus. Okay, so this is what. And we have Frey syndrome. This is very important. It is also asked as 3 marks question. Okay, so this is also known as gustatory sweating or auriculotemporal nerve syndrome. So this usually occurs after what? Usually after a parotid surgery or trauma. So why does it occur now? So here what happens is when we do the surgery of this region, there is injury to these nerves, that is the auriculotemporal and great auricular nerve. Okay, so both can be injured here because they are in close relation here, because great auricular will be supplying the angle of the, this thing near the angle of the mandible, it will be supplying the skin here. Okay, so during injury, during the healing process, what happens is, the auriculotemporal nerve, it is secretory motor, no? So it secretes, it helps in the secretion of the gland. So these fibers will join the great auricular nerve, okay, and reach the sweat glands also. So what happens is whenever there is stimulation of, that is the salivary secretion stimulation, like when you see the food, your mouth waters, isn't it? You secrete saliva, it salivates. As well as when we are eating, it salivates. Okay. So that time what happens on that region, there will be sweating. Okay. Because saliva is secreting, that is secretomotor fibers. And these secretomotor fibers are intermingled with the great auricular nerve also. So simultaneously what is happening? The skin over that parotid region, right? That is also getting stimulated. So it becomes very warm. Okay, it will be warm, it will be sweating, and there will be redness also. In fair skin people, you can appreciate the redness also. Then mixed parotid tumor. Okay, mixed parotid tumor is usually very common condition. So it is a slow growing tumor. It is not a malignant one. It is a benign one. It is painless. Okay, and it doesn't involve the facial nerve. So you can very easily remove the parotid gland. Like your usually parotid gland, no, that part is removed by piecemeal. We say piecemeal means like how you do the dissection of parotid gland, the same way it is dissected. Okay, it is removed. Sialolithiasis. Sialolithiasis is formation of the stones within the gland and the duct. Okay. So usually this is more common in the submandibular, but it can be seen in the parotid gland also. So it's a calcified form mass which is formed within the gland. So these are the conditions which you need to write. Okay. So to just briefly to summarize. So usually if it is a gland, what will you write? Can anyone tell me? Yes, Fauzia, you can unmute and tell me. So any gland, what are the things you're going to write? Okay, so first you will write a little bit about the intro of the gland. Okay, so what is it? What type of gland it is and all those things. Okay, so and then you will write its location. Okay, so parotid gland weighs about 25 grams and it is the largest salivary gland. So those things you are going to write in the intro part, where it is located. Just a word is enough. Okay, you don't have to use sentences and write because time management is important. So when you have to manage the time, it is always like, with bullet points, you can just write what is the thing. Then location, you'll write about the, what is that? Before presenting parts, you will write about the capsule, true and false capsule. Then you will write about the presenting parts. Then after that, you will write about the relations to all the presenting parts. Then structures in the relations only. It also includes the structures passing through. Okay. Structures passing through it. And then after that, about the word about parotid duct. Okay. And then you will talk about the nerve supply, which is important here. And lastly, about the applied aspects. Okay. So these are the things you need to write. Okay, so this is the summary of the parotid gland. So next question, we talk about the muscles of mastication. So this is another question which is very commonly asked. Okay, so how will you write about the muscles of mastication? So what are the things you need to write? Okay, so you have to classify the muscles of mastication. You have to write about the characteristic features. And about each muscle, you have to write about the origin, insertion, nerve supply, and action. Okay, so these muscles of mastication are classified as primary muscles and accessory muscles. What do we mean by primary muscles? They are the main muscles which bring about the movement during mastication. Okay, and accessory muscles are the muscles which will help these primary muscles. Okay, it's like the supporting muscles there. So which are these principal muscles now? We have the temporalis, the lateral pterygoid, the masseter, and the medial pterygoid. Okay, so these four muscles, the temporalis, lateral pterygoid, masseter, and medial pterygoid are the principal muscles. Then you write which are the accessory muscles. Okay, accessory muscles are the digastric, the geniohyoid, mylohyoid, buccinator. Okay, so these muscles are accessory muscles. So you will list out the muscles. After you list out, next you are going to talk about the characteristic features. So what is it? First is, it is located in and around the infratemporal fossa. Okay, infratemporal fossa. Second is, they are all inserted into the ramus of the mandible. Third is, they are all innervated by the mandibular division of trigeminal nerve. So mandibular division of that is basically by the branches of the mandibular nerve, they are supplied. And they are concerned with the movements of the mandible, okay, on the temporomandibular joint. So basically, they are helping the mandible to move. This is the characteristic of masticatory muscles, okay. And importantly, that are embryologically, they are all derived from the mesoderm of the first pharyngeal arch, the branchial arch. So that is why they are supplied by the mandibular division of trigeminal nerve, because mandibular nerve is the nerve of the first arch. So temporalis muscle. So temporalis muscle, when we see here, so temporalis muscle has the origin from where? Okay, so this is like a fan-shaped muscle you see. So it is originating, okay, so if you see here, it is originating from the, what is this? This is the temporal fossa, okay? So it is originating from the temporal fossa and along the superficial temporal line. So from there it originates. It also originates from the temporal fascia also. And this muscle fans out like a fan-shaped muscle. And all the fibers, they condense there, they form a common tendon, and it gets inserted into the coronoid process, okay, to the coronoid process of the mandible, okay. So you can see it all around the coronoid process of the ramus of the mandible, it gets inserted. Temporalis, so you can see, okay. So to the tip, along its anterior border, and along its medial surface, all those places it gets inserted. Nerve supply is by anterior and posterior deep temporal nerves. And next muscle is masseter muscle. So masseter muscle has the origin from the zygomatic arch, okay, zygomatic arch, as well as from the maxillary process of the zygomatic bone, okay. And it gets inserted on the ramus of the mandible, as well as little bit to the coronoid process also. So when this muscle is getting inserted, it has three strata of muscles, the deep layer, the middle layer, and the superficial layer. Okay, so it basically originates from the surface. So according to the superficial, middle, and deep, it originates from the superficial, from the this is superior border, the surface, as well as the inferior border. So from all these three parts, these three layers of the muscles, they originate and they get inserted to the ramus of the mandible. So this muscle, it is supplied by the which one branch, that is from the anterior, that is nerve to masseteric muscle, okay, or masseteric nerve. So it is, which is a branch of the anterior division of mandibular nerve. So that it will supply the muscle. So you can see the action during the mastication process. So usually, when this nerve is injured, okay, the nerve to masseter muscle, the jaw gets kind of fixed, like, it has the full, like, the smile is very wide, like it, but it is a very painful smile, okay. It gets just fixed with a wide angle like that. That condition is known as trismus, okay. That is basically because of the spasm of the masseter muscle. Then we have the lateral pterygoid muscle. Lateral pterygoid muscle is the key muscle in that region, okay, because there are many structures in relation to lateral pterygoid. Now, this lateral pterygoid it has two heads, the upper head and the lower head, okay. So upper head is coming from the infratemporal surface of the greater wing of sphenoid, okay. Infratemporal, this is zygomatica. So below that, you will be seeing the infratemporal surface of the greater wing. So here actually it is removed. So this surface here, this will be the greater wing of sphenoid. So infratemporal surface of the greater wing of sphenoid, we have the upper head coming. And from the infratemporal crest also, that is this side, okay. Infratemporal crest, also this upper head comes, okay. So that is the origin of upper head. The lower head of the lateral pterygoid comes from the medial surface of the lateral pterygoid plate, okay. So, and these both the heads, they fuse together. So here it gets inserted, okay. They get inserted into the, what is this? This is the pterygoid fovea, okay, in the condylar process of the mandible. So there it gets inserted. And this upper head, some of the fibers, they continue as the articular disc. So actually the articular disc of this temporomandibular joint, it is considered to be the detached fibers of lateral pterygoid. Okay, you should keep that in mind. That is asked like a Viva question. So this is the thing, okay, and this is the pterygoid fovea where it is getting attached. So you can see here. And you can see some of the upper fibers, how they are going around and forming the articular disc of the temporomandibular joint. So nerve supply is by the branch from the anterior division of mandibular nerve. Okay, so anterior division of the mandibular nerve supplies the this way. What is that? Lateral pterygoid muscle. Okay, that is known as the nerve to the lateral pterygoid. So why it is a key muscle? So you can see here. Okay, so this is the maxillary artery. So maxillary artery is divided by this lower head into three parts. The first part will be up to the lower border of the lateral pterygoid. Second part will be in relation to the lateral pterygoid. Third part will be above the superior border of the lateral pterygoid muscle. So like that, maxillary artery is divided like we have in upper limb. We have the pectoralis minor muscle dividing the axillary artery into three parts. So similarly, here we have this. Okay, so which are the relations now? So relations here will be the superficial relations will be the ramus of the mandible. Okay, the masseter, the tendon of, because lateral pterygoid is asked as a separate question also. So that time you need to write all these things. But for the muscles of mastication, this is not necessary relations to write. You can just write origin insertion. But since this is a very important muscle, it's a key muscle of that region, I'm just including it here itself. Okay. So you have to write about the ramus, the masseter, the tendon of temporalis, superficial head of the medial pterygoid, masseteric artery and its temporal and masseteric branches. They form the superficial relations. Whereas the deep relations, it includes the mandibular nerve, middle meningeal artery, then temporomandibular spinomandibular ligament and deep head of the medial pterygoid. So those will be the deep relations. And here, if you see, there are certain structures which are emerging along the upper border. Okay, so one will be here, if you see this portion, we have the masseteric nerve, okay, and the deep temporal nerves and the deep temporal arteries. Okay, and structures passing through the gap. So this is the gap between the two heads, upper head and lower head. So here what is passing? One is the maxillary artery, another one is the buccal nerve. Okay, this buccal nerve is not the branch of facial nerve. This buccal nerve is a branch of mandibular nerve. Remember that, okay? And then we have the lingual nerve. This is along the lower border. We have lingual nerve, the inferior alveolar nerve, and the middle this one. What is this? Inferior alveolar artery. Okay. So these are the structures which are emerging along the lower border. Okay. So this is this much you need to write for relations. Then medial pterygoid. Okay, so next muscle is the medial pterygoid. So medial pterygoid has again two heads, just like lateral head we had upper and lower. This has superficial and deep. Okay. So here the which one? Yeah, superficial comes from the tuberosity of the maxilla, okay? And the deep head will come from the medial pterygoid plate, okay? So it comes, from the lateral surface of the lateral pterygoid plate, okay? So it comes from that. And both these heads here, you can see this one here, it is inserted into the okay, so ramus of the mandible. That is the posterior inferior part of the medial surface and the angle of the ramus of the mandible. It is inserted. Okay. So this is the deep head. Okay, what is coming here? So it is coming from the medial side of the medial pterygoid plate. Sorry, I said lateral, I think. So nerve supply is by the nerve to the medial pterygoid. This nerve to the medial pterygoid is one nerve which is directly coming from the trunk of the mandibular nerve. Okay. So what is the next? You have to write about the action. So nerve supply, origin, insertion is over. You have to write about the action. So what are the actions here? So basically the movements of the mandible. So when we have to close the mouth, we elevate the mandible. When we have to depress, we, open, we depress the mandible. When we have to, retract, that is when we protrude, okay, protrude and then we pull back, that is the retraction. So these are the movements of the mandible which happens, okay. So here if you see, this temporalis will elevate and retract, okay. The lateral pterygoid will protrude. So this is kind of easier way to remember. Lateral pterygoid will protrude and it will depress. Medial pterygoid will elevate and protrude, okay. Masseter will elevate and protrude. Okay, so those are the actions. The accessory muscles, just a word about it. That is, one is digastric. So we already learned about digastric, that it has anterior belly, posterior belly. Anterior belly origin is from the digastric fossa. Posterior belly origin is from the mastoid notch. So both of them are getting inserted, forming they form a common tendon, and that tendon is inserted to the greater corner of the body, greater corner of the hyoid bone here. Okay, so intermediate tendon which is attached to the body of the hyoid bone. Then we have the buccinator. Buccinator muscle, again, it has the origin from this tendinous arch, which is between this pterygoid hamulus, that is from the the maxillary tuberosity here. This is the maxillary tuberosity. There will be a tendinous arch attached here to the pterygoid hamulus. So from there it comes. The maxillary tuberosity, also the fibers arise, and the outer surface of the alveolar process of the maxilla, as well as the outer surface of the alveolar process of the mandible, okay, as well as the pterygomandibular raphe. So from these, so like a C-shaped origin it has, okay. So when it is getting inserted, what happens? The fibers, they cross over, like the decussate, means the lower fibers, they go upwards and upper fibers come lower, okay, and they get inserted along with the orbicularis oris muscle. Then the next muscle is mylohyoid. So it comes from the mylohyoid line, okay, and it is attached to the hyoid bone, okay, the lower part of the front of the body of the hyoid bone. Okay, so we have a pair, no? So in the middle, there is this fibrous raphe. Okay, so these upper fibers and all, they are getting attached to the fibrous raphe, whereas the lower fibers will get attached to this hyoid bone. Then geniohyoid. Geniohyoid is from the inferior genial tubercle and gets inserted to the body of the hyoid bone. Okay, these things above the medial part of the mylohyoid muscle and all, if you can't remember, it's not necessary. But main key points you should know, that where it is coming and where it is getting inserted. Okay, so how do they help? Okay, so protrusion, the lateral pterygoid and medial pterygoid. Retraction, posterior fibers of the temporalis, deep part of masseter, geniohyoid and digastric. Elevation of the mandible is by temporalis, masseter and medial pterygoid. Depression is by gravity, digastric, geniohyoid and mylohyoid muscles. So all this will help in the, that is how it will help in the movement of the mandible during mastication. Okay, so how do we summarize now? Can anybody tell me how we summarize, or what are the things we need to write? Okay. So that is important. Always when you learn, make the headings, what you need to write. Okay. So this was muscles of mastication. So muscles of mastication, we write under which headings? We write where are they located? Okay. And their classification. Then we write about classification. When you write primary and accessory, you have to list it out. Which are the primary muscles? Which are the accessory muscles? Okay, so primary muscles, we have 4. And accessory muscles, we have mylohyoid, suprahyoid muscles, or mylohyoid, geniohyoid muscle. Then we have digastric muscle. Okay, so they form the accessory muscles. Then you have to write about the characteristic features. Then after that, you need to write about the origin insertion of each muscle, origin and insertion. then nerve supply and action. Okay. So this is how we summarize. So applied aspects, basically you can talk. So whenever there is the one is trismus, you can talk about where there is injury to the nerve to messenteric muscle, where it gets fixed in a wide smile-like state. Okay, the lips are retracted back. That is basically, it is like, the teeth are held clenched, like, okay. And the third important question is the temporomandibular joint. Okay. So whenever we write a joint, you have to know this headings under what we need to explain the joint. Okay. So joint is explained under the following headings. One is the type of joint you have to write. What is the type of joint? Then you have to write about the articulating surfaces, the ligaments, the relations, movements, okay, and muscles producing the movements there, as well as the applied aspects you will write. Okay, so first is articular surfaces. So articular surfaces and the type of joint. So what is the type of joint here when we talk about the joint is, it is a bicondylar type of synovial joint, isn't it? So it is a condylar type of synovial joint. That's all you need to write. Okay, it's a condylar type of synovial. So which are the two things which are articulating? One is the condylar process of the ramus of the mandible. Okay, the condylar process of the ramus of the mandible. As second is the mandibular fossa. Okay, so those two things, they form the, this is the mandibular fossa. Okay, and the articular eminence. So these two will be the articulating surfaces. Okay, and in between these two surfaces, that is the head or condyle of the mandible, as well as the articular fossa and articular eminence, we have the intra-articular disc. Okay, so here it is. So a little bit about the articular disc here. Okay, so this articular disc, why here it is important is, it will divide. It is basically a fibrocartilage. Okay. So this fibrocartilage, see, mind you, this surface is covered by hyaline, but this disc is made up of fibrocartilage. Okay, so it will divide this joint capsule or the joint cavity. Okay, it will divide it into two compartments, upper compartment and lower compartment. Okay, so this articular disc is morphologically, when we say, it represents the degenerated primitive insertion of this lateral pterygoid muscle, which I mentioned earlier. Okay, right. So this disc, structurally, when we see, it has 5 parts. Okay, so first, from before backwards, when we say, this is known as the anterior band. This is the anterior band. This is the anterior extension. So anterior extension, anterior band, intermediate zone, thin zone, posterior band. And the posterior band will split into two. Upper lamina getting attached to this tympanic plate, and lower lamina, which will get attached to the head of the mandible. Okay, that is almost below the head of the mandible, near the neck it gets attached. Okay, so the entire joint is, since it is a synovial joint, it is covered by the joint capsule. So the joint capsule forms one of the ligament providing support. Okay, so we have the joint capsule, the lateral ligament, the spinomandibular ligament, and stylomandibular ligament. Okay, so they form the main out of the primary ligaments of the joint. Whereas the accessory ligaments, okay, so now here if you see, this is the fibrous capsule which is enclosing the joint. Okay, then we have the spinomandibular ligament, that is from the spine of the sphenoid to the lingula, and there is the stylomandibular ligament, that is from the styloid process to the angle of the mandible. Okay, so these form the ligaments of the joint. Okay, so these are some of the structures which are in relation to the joint. Okay, so here we will see, this is the external carotid artery. Okay, this is dividing into the maxillary as well as the superficial temporal artery, right? Okay. So here you can see, near this joint, one of the important structure, that is the auriculotemporal nerve. It forms basically when it is, this is the middle meningeal artery. Okay, so around it, it forms a loop. Okay, two divisions of it, it will join to form and it will pass across this joint up. Okay, so auriculotemporal nerve. Then we also have in front of it, we have this mandibular nerve with its anterior and posterior divisions, okay, which divide further. So here posteriorly, this is already what I told you, okay, the spinomandibular, the middle meningeal artery is there, okay. This was the maxillary artery. So here, when we take a section, it is looking this way, okay. So these are the relations which you will write. Then movements of the joint. So movements of the joint. What are the movements? Similarly, like how we had those muscles of mastication helping, same thing will come here. So basically the movements we have protrusion, retraction, elevation, and depression. Okay. So the muscles of mastication which brought about the movements are the same muscles which are bringing about the movements of this joint. Okay. So protrusion is by lateral pterygoid, assisted by medial pterygoid. Retraction is mainly by temporalis and deep part of the masseter muscle, which is aided by geniohyoid and digastric. Whereas it is elevated, okay, elevation is by temporalis muscle and the medial pterygoid. Depression, the gravity also helps along with the digastric, that is basically the accessory muscles, digastric, geniohyoid and mylohyoid muscles. Okay, so common conditions here, this usually when we yawn very widely and, when we have to take a large chunk of food, like if with a wide mouth, sometimes this, what is the head of the mandible, that is the joint, okay, it gets dislocated, okay, it comes in front and it gets like, the face gets fixed in an open mouth state. So that can be reduced, both the thumb is placed inside near this angle here and slowly it is pushed backwards. Okay, so that is the thing. Another thing is there will be arthritis of the joint, means will be inflammation is very common in this region, especially those people who have the habit of always clenching their teeth, biting the teeth or, grinding their teeth kind of thing, habit. So those people, there will be temporomandibular joint arthritis, okay, or inflammation there. Okay, so next is mandibular nerve. So mandibular nerve here, any nerve, when you're talking about, you need to know the origin, the termination, okay, where it originates, how it terminates, its course, branches, okay, and applied aspects. So this origin, it is one of the divisions of the, what is that? Trigeminal ganglion, isn't it? This is a trigeminal nerve. Trigeminal nerve, one of the division is the mandibular nerve. So it passes through this trigeminal ganglion here, okay. And then from the intracranial cavity, it comes out through the foramen ovale. As soon as it comes out, it runs for about a centimeter and then immediately divides into an anterior division and a posterior division. That's all its course. Okay, so it terminates below the foramen ovale, okay, by dividing into anterior and posterior divisions. Now, what are the branches of this anterior and posterior divisions you should know? Okay. So here, if you see, the branches coming from the trunk, branches coming from the anterior and posterior division. Okay, so this is the anterior division. So here, if you see, from the trunk, we have the nerve to the medial pterygoid. So that is coming directly from the trunk, as well as the nervus spinosus. Okay, nervus spinosus will enter again through the foramen spinosum. It enters again the intracranial cavity. So this nerve to medial pterygoid will supply the medial pterygoid as well as the tensor tympani and tensor pallati. The anterior division, always remember, it is mainly motor. Okay. And the only sensory is the buccal, which supplies the skin, oral mucosa. Okay. So this mesenteric nerve supplies the masseter muscle. Deep temporal nerve supplies the temporalis, nerve to lateral pterygoid. So these are all the motor nerves or the muscular branches. Then we have from the posterior division. Posterior division is mainly sensory. So we have the lingual nerve supplying the taking the general sensation of the tongue, then auriculotemporal nerve. Then we have the inferior alveolar nerve. Okay, so the inferior alveolar nerve enters through the this one, that is the mandibular foramen. It enters, okay, and it comes out through the mental foramen, dividing into incisive branch and the mental branch. It gives a small, before entering the mandibular foramen, it gives a mylohyoid nerve. So this branch is motor, which supplies the mylohyoid muscle as well as the anterior belly of digastric. Okay, so those are the things. So what you have to remember, very important, is okay, so the mandibular nerve. Okay, so mandibular nerve, easy things to remember there will be like, it emerges from the foramen ovale. As soon as it emerges, it will divide into an anterior division and a posterior division. Okay, so anterior, this one, where only two branches. Now to medial pterygoid muscle, and we have the nervous spinosus or nervous spinosum. Okay, that because it enters the this one. What is that? For foramen spinosum. We have the anterior division here. So anterior division, always it is mainly motor. Okay, it is mainly motor. Only sensory is the buccal there. Okay, posterior division is mainly sensory. Okay, sensory here, except for nerve to mylohyoid. So nerve to mylohyoid here, it is coming from the inferior alveolar. Okay, because posterior division gives lingual, auriculotemporal, then inferior alveolar. Inferior alveolar will give the nerve to mylohyoid, which is the only motor in the posterior division. Right. Okay. So short answers here, maxillary artery. Maxillary artery, now any artery when you are writing, you have to follow the same origin, termination, course, branches, and applied aspects. Maxillary artery commonly asked, like, as a short answer, 3 marks question, mainly the branches. So here, if we see maxillary artery, it is the terminal branch of the external carotid artery given in the parotid gland. Okay, this artery, it runs in the infratemporal fossa, where it is divided by the lateral pterygoid muscle, that is the lower head of lateral, into 3 parts. First part, second part, and the third part. Okay. So to remember the branches, okay, so remember the branches. An easier way is the first part branches. Okay, from the you remember dam AI. Okay, dam AI. So D is for deep auricular, A is for anterior tympanic, M is for middle meningeal, A is for accessory meningeal, and I is for inferior alveolar. Sorry. Inferior alveolar. So these are the branches from the first. Second is all muscular branches. Second part, which is in relation to the lateral pterygoid branch, it gives all muscular. Okay. So they are deep temporal. Okay. Then we have mesenteric branch. Then we also have buccal. Okay. So these. And for the lateral pterygoid. So it supplies all the muscles there. Then we have from the posterior division, that is the third part, we have, you can remember, pig pass. Okay. P is for posterior superior alveolar. I is for infraorbital. G is for greater palatine. Okay. And P is for pharyngeal branch. A is for, okay, this is artery of the pterygoid canal, and S is for spinopalatine. Okay. So posterior superior alveolar, infraorbital, then greater palatine. Then this is for pharyngeal branch, and A is for artery of the pterygoid canal. S is for spinopalatine. So that is the easier way to remember. The next question is otic ganglion. So whenever we write about otic ganglion, you have to remember, you have to write the question as the following headings. That is the introduction, location, and the connections and the branches. Okay, so this is the thing. So here, otic ganglion, when we write, you have to remember that what it is. Okay, first introduction, when we write about the introduction about the otic ganglion. So what type of ganglion it is and where we see it, we need to write. Okay, so that is the thing. So when we talk about the otic ganglion here, okay, we have the otic ganglion here, right? So it is a small oval parasympathetic ganglion. Okay, it's a parasympathetic ganglion. So what about its introduction? You will write it is a parasympathetic. Okay, then you will write that it is about 2 to 3 millimeters in size. Okay, and where it is situated? It is situated in the infratemporal fossa. Infratemporal fossa it is located. Okay, right. And topographically, this is related to the which nerve? It is reconnected to the mandibular nerve. Topographically means location wise, it is related to the mandibular nerve. You can see here, this is mandibular nerve. It is related to the mandibular nerve, but functionally it is associated with the glossopharyngeal nerve. Okay, glossopharyngeal, because that passes there. You can see the inferior salivary tympanic branch, all these things passing through this otic ganglion. Then you will write about the roots and connections. Okay, so roots and connections, when we write here, okay, so it has a parasympathetic or a motor root. It has a sympathetic root, okay, and sensory part. So the parasympathetic root, if you see here, it is derived from the inferior salivary ganglion. Okay, so from the inferior salivary ganglion, it begins. Okay, so the preganglionic fibers begin from that. Okay, then through the tympanic branch forms the tympanic plexus and the lesser petrosal nerve. So to this comes the parasympathetic root. Okay, so this will relay here and the parasympathetic, that is through the postganglionic fibers, will begin. Whereas the sympathetic is derived from the plexus around the middle meningeal. Okay, plexus around the middle meningeal artery, and it will be conveying the, here it is, this, don't think about this, just was to show the parasympathetic. Okay, so sympathetic is derived from the nerve plexus which are present around the middle meningeal artery, and they convey the postganglionic fibers similarly from the superior cervical ganglion, and it goes, okay, without relay, because these are already the postganglionic fibers coming from the superior cervical. Then we have branches. Branches, it gives the postganglionic parasympathetic, which through the auriculotemporal nerve are secretomotor to the parotid gland. Then postganglionic sympathetic fibers, which are passing through, which are vasomotor. They supply the blood vessels of the parotid gland. Okay, and also fibers from the nerve to the medial pterygoid. Okay, fibers from the nerve to the medial pterygoid will also pass through that, and they supply the tensor pallati and the tympanic muscle, tensor tympani and tensor velli pallati muscle. Okay, so these are the things which you need to remember about the otic ganglia. Here, so with this we conclude today's class. Thanks for watching Auricle, and those who haven't yet downloaded the app, you can get it on Google Play or App Store, and you can also follow the contents on social media handles where we are there. Okay, so thank you. Have a good day. Thank you.